Hi ladies, so I'm going to take you through a little warm-up that you could do for a workout if you don't have a lot of time, or something that you can do before a workout. This may not be suitable if you're pregnant, so make sure that you are checking in with your GP, midwife and everyone like that before you commence any training. The first thing that we're going to do is some pelvic floor and TA activation. So I'm going to do this with the ball in a second, but first I'm going to do a set without the ball. So I'm going to actually get into 4-point kneel position, which is here. So if you are pregnant, this should feel okay, provided that you still feel comfortable to get in this position with belly. So when we're in this position, we don't want to be like this, and we're not going to be like this. So we're going to find neutral. So if you sort of have a bit of an anterior tilt, which means your pelvis dips forward, then what we're doing is we're just going to breathe in, breathe out, roll the shoulders down and back, and then lift the hips up a little bit there. It's sort of like you've got a string attached to your belly button and you're pulling it up here. And what you do is you actually feel your transverse abdominis activate here slightly, so you'll feel a lot more supported here. Then what we're going to do is, this is our start position, we're going to breathe in and we're going to relax our pelvic floor. Breathe out, lift and squeeze pelvic floor. Breathe in, breathe out, breathe in, breathe out, breathe in, breathe out, breathe in, breathe out. Okay, now we're going to relax. So in between sets, you can actually get into child's pose stretch if you want. If you're pregnant and this position is not comfortable for you, you can stay in 4-point if you feel okay, and you can go into either an elephant stretch, which is basically just opening up the thoracic back, or you could go into a little bit of a chest stretch here on each side. You could even just do some dog stretches. So it's called a dog because you sort of wag your tail, and just do that if you feel like it. Now we're going to do another set here. This time we're going to add our transverse abdominis. So remember, those are the deep core muscles here. So you can either pull your hip bone, or you can peel your skin down away from your undies or your pants towards your tailbone to get an activation here. So by all means, if you need to change position, if you do this usually side lying or laying on your back or sitting, then go for it. But we're doing 4-point kneel here today. So we're going to breathe in, relax, breathe out, lift pelvic floor, then activate TA. And you can see how when you look at my belly, it sort of goes in and then up. So I'm not exhaling and then pushing out. We're breathing in and up. I can also get a little bit more activation if I push my hands into the floor, so you can give that a go as well. So breathe in, breathe out, pelvic floor TA. Breathe out, breathe in, breathe out, breathe in, breathe out, breathe in, breathe out, breathe in, breathe out. I'm going to do one more. Breathe in, breathe out. Good. So again, if you want to go into a stretch here, you can. So I'm going to let you guys stretch for a second. I've got a Pilates ball or a soft ball here, which I'm going to use for the next exercise. If you don't have one of these, all you need is something that you can squash. So whether it's a rolled up towel, a pillow, a teddy bear, anything like that that you can put pressure into. So what we're going to do is we're going to get back into that position, and we're going to pop the ball under one of our hands like this. And then we're going to do what we just did with the pelvic floor and TA activation, except this time we're going to go for a little bit more deep activation, so it's going to feel a little bit more intense. We're going to press our hand into the ball as we exhale And as you exhale, you can go for a longer exhale to get all that air out, to get that deeper connection. Imagine you are breathing that air out through a curly straw. So it will take a few seconds. So we're going to do about 5 on each side. So we're going to breathe in. Remember, we're getting into that nice straight position. So we're not like this. Activating TA there. So it's slightly on already because we're in that straight position there with our pelvis. So breathing in, relax. Breathe out. Pelvic floor TA. Squeeze. Relax, breathe in, breathe out. So you can see your well, you can see on my belly, it just goes a little bit smaller, so I know that I'm getting a deep activation. So I'm going to do 3 more of these. Breathe in, breathe out. Pelvic floor TA press. Breathe in. Breathe out. Do one more. So I'm breathing in here. Breathe out. Now we're going to swap sides. If you need a rest in between, have a rest and have a stretch. So when I breathe in, I'm relaxing pelvic floor. When I breathe out, I'm lifting pelvic floor, squeezing. Then I start to activate my TA. Then I press the ball to get more of an activation as I'm exhaling all of that air out. So it's a few things to think about, but once you do this a few times, it makes more sense. Breathing in, breathing out. Now, have a break if you need. If this is hurting your wrists, you can grab a pillow and you can go to knucks, so knuckles, and press that way. You can even, depending on how you're feeling, you can go to your elbows and you can do this with your hands nice and straight like this. So basically to assist with the wrist pain, we want to get rid of all creases. So when our wrists are like this, we've got creases, right? When we want to avoid our wrist pain, we want to keep them nice and straight. So you can do the same thing, but you're in a slightly different position here. So breathing in, relax pelvic floor, breathe out, lift and squeeze pelvic floor. Exhale and squeeze the pillow or the ball or whatever it is you've got. So you can substitute it for that. You can even, I'm just going to lay down on my back. If you've got a chair or a couch, pop your legs up on them like this. Okay, so they're resting on the chair. Then you can pop the ball or the pillow in between your knees. And you can do your pelvic floor TA breath. Then squeeze, so you're going to squeeze your knees together. As you exhale, remember in and up. You're going to get a really nice deep core activation here with your TA as well. So this is called a 90-90 breath. So you could do that with a foam roller, towel, a pillow, a ball. If you've got some wrist issues and you don't want to do that 4-point kneel with the press, so remember you can just pop your legs up on a chair or a couch. So the couch will be up to there. Put the ball or the squishy thing in between your knees. You're going to breathe in, relax. Breathe out, lift pelvic floor TA, squeeze the ball. This really nice deep activation. And exhale it all out. So those are some different pelvic floor and core exercises that you can do to get a real deep transverse abdominis activation.